you need that base level of understanding. And it's like, okay, so you have knee pain. It's like, especially you're a clinician, so you can speak a little bit more. You can do some of those hands-on assessments. You have a wider scope of practice than I do as a personal trainer, strength and conditioning coach, whatever you want to call it. But I have a bit of a narrower scope of practice, so I'm not diagnosing anybody. I have no idea what's going on, but you tell me you have knee pain. Okay, well, I understand how the foot works. I understand how the knee works. I understand what the hips do. So we're going to try a few things that get them working the way that they're built to work. And we'll probably be able to find some kind of solution. And if not, then I'm going to refer out. And I'm always very transparent about that. My scope of practice means that there's some times where it's like, hey, here's my line for scope of practice. And at this point, I'm just going to refer out and send you to a clinician, somebody that can formally diagnose this. And then that way we know exactly what's going on. But 9 times out of 10, it's something that you can correct in a gym setting. You just have to have that base level of understanding of how the body works and how to apply it with the equipment you have.
Yeah, I absolutely agree. And that's such a nice, I'll call it a scapegoat, but it's like such a nice reality to have, is that like at a certain point, it's not your responsibility to figure this out anymore. Right. So if you can have that conversation, you can communicate with them like, hey, this is what I'm going to do for you. And this is what I can do within my scope. And if you're willing to give that a try and treat this in a more conservative manner, I think we can have some progress. And then again, you're getting buy-in around what you can do. And if it starts to deviate from something you're comfortable with, like, hey, I think you should see a clinician about this, or I think it's time to get some imaging on this because we're not seeing improvement at the rate I'd like to see it in the areas that I'd like to see it. And I'll be honest, like, yeah, I do have a bit more of a broad scope because I am a clinician as well. But I have the same exact conversations with every single one of my clients because for me, the conversation that I have to have a lot of times is, should I get surgery or not? Right. And I think that's like maybe a step above the conversation that a lot of personal trainers or strength coaches will have, because it's not really up to them to give guidance in that scenario. It's like, talk to your clinician, talk to your provider, like see what they say. But like, I'm the guy that I have to talk to about that a lot of times. And the thing is, like, because of my background, I take the same approach that you would in that. It's like, hey, like, and I do have a bit of background knowledge in situations that like, all right, maybe you should get surgery, maybe you shouldn't. But I'd say 9 times out of 10, the people that come to me, like they come to me because of what I do. And it is more of a rehab setting. It's people that are motivated to get better without going under the knife. I'm like, let's give this a try. Like, give me 6 to 8 weeks. Like I've had, I don't know, a few different rotator cuff patients in the last like 6 months. And it's very clearly a rotator cuff tear. And the conversation I have is like, look, there is damage to the tissue here, but that doesn't necessarily mean that you have to get surgery if you don't want to get surgery. So I can give you things that will help your shoulder function better and take stress off of the rotator cuff tendons. And then we can see where the pain and the functionality levels out at that point. And then we can make a decision then. We don't have to make it right now. And I don't think the conversation has to be any different, whether you're a trainer, whether you're a clinician, but you do have to have that knowledge. You do have to have an understanding of how the shoulder works and how you can assess to see where their deficit in that shoulder complex is. And if you can make improvements somewhere in there, anywhere in there. This is the part that I'm talking about that like, I don't fucking know a lot of times, but I'm going to continually assess in the aspect of I'm watching you every single time that you move. I'm watching for, lack of core stability. If you have trouble moving or stabilizing the scapula in a certain plane, or like shoulder rotation, like where does this deviate from what I'd want to see? And those are the things that I try and clean up. More times than not, you'll have a positive impact on the symptoms that they're having. And yeah, sure, there'll be times like a complete rotator cuff tear. I'm not going to tell anyone that I can fix that with exercise. Like, yeah, maybe go get the surgery, but like, grade 1, grade 2, like on the more minor side, like it's going to heal to some degree. Let's see how it heals. And then if you don't have the level of functionality that you'd like to have out of that shoulder, then let's talk about surgery. And I think that's like almost a blanket statement that you can have that conversation if you're a trainer, but you're just maybe approaching it with a little more tact around like giving them direction. But you can have a lot of confidence in telling them what you can do and what you'd like to see in that process.
100%. And you said it too, where you just need time. Like give me 6 to 8 weeks. It takes tissue time to adapt. So you need to get that buy-in, and you're not going to fix a rotator cuff issue in 2 or 3 hours. It's going to take a few weeks. But if I can give you a few things within those first few hours that help you feel a little bit better, that's the buy-in. And then that's all you need. And I used to tell trainers that all the time too. And I was in more of like a manager role when I was at gyms, and I was responsible for training them to be good trainers. I said, all you need is more time with your client. If you can get them in for that initial consult, that initial hour, all you need to do is get them to stay with you for a couple more hours. Because the more time you have, the more time you have to build that rapport. There's thousands of trainers out there that are really, really great at their job, and that client could go to any one of those people and get the same result. You are the difference. And you alluded to that before too, where they're coming for you. So once they get their results, they're going to keep coming back for results. But those initial few weeks, they're coming for you because they've got that buy-in. And so as long as you can have them feeling a little bit better or have a good time. And again, in your case, talking just about like scope of practice with clinicians versus like my realm and what I can handle, the biggest thing is that they have fun too in the first few hours. Because if they have fun, they're going to want to keep coming back to you. The gym I currently work at, that was one of the first things I asked him, the owner of this gym. He worked with me in the commercial setting, as I mentioned. And I asked him in the first couple of weeks, he had a ton of clients. He always had a full roster. Even now, he's always feeding hours. And I asked him in the first couple of weeks, I said, what's the trick that you like to use? And I know there's no magic thing to it, but what do you do to make sure that clients keep coming back? How do you get them to sign up for these big commitments, these big contracts? He said, make sure they have fun. It's like the results are going to come as you go, but if they don't have fun, they don't want to come back and pay you their money. So if you can make sure they have fun, if they're in pain, make sure they're in less pain after they leave you. That's how you get that buy-in. And then with enough time, they keep coming back, that adaptation is going to come. And then from there, you can make that decision. Because like you said, I mean, I partially tore my ACL in the summer. And so Canada's terrible for like MRIs and doctor's appointments. Like this free
Yeah,
healthcare thing is great on paper, but it's a pain in the ass. So I tore it at the end of May, and it took me until mid-August to get my MRI. And I was hustling. Like I was working the system. I was getting on cancellation lists. I had my requisition in 2 days after I'd torn it. And so it took me a couple months to get my MRI. Got my MRI. And it took me another month after that to meet with the surgeon. And at that point, it had been 4 months. So any tissue around it was healed. And because it was a partial tear, which I didn't know at the time, I figured it was ACL when it happened because I was just falling over for no reason. And I was like, this makes sense. And the mechanism of injury was full on just knee valgus too. So I was like, yeah, that checks out. There's probably something going on here. Tissues are definitely torn. But it wasn't until I got that MRI result, and he was like, yeah, well, he's like, how do you feel? And I was like, I've been working out. I'm strong again. I'm lifting heavy weights again. I'm just, the only things I haven't done, I'm avoiding like plyometrics, change of direction, sport, just in case, because I don't know how bad this tear is. But I was like, I'm working out. My body feels good. Like I feel strong again. He's like, yeah, you don't need surgery. You're good. There's enough tissue intact. Because by the time I got to the surgeon, he was like, yeah, everything's healed. You're good. If it's
cool.
going to fully tear, it's going to fully tear. But that would take like another traumatic injury. So he's like, just go about your life. And I was like, sick. Okay. So I got the green light to just start doing what I was doing before, which was cool. But
Yeah, that's unreal.
like you said, the tissue takes time, and you don't always need to go the surgical route. And so when people are coming to you asking you, it's like, well, there's a chance we can make this non-surgical. And if you can avoid surgery, that's always best case. If you can avoid going under, and you can avoid more tissue damage and more inhibition, because then that's a longer period of time that your nervous system is telling you that you're not okay, then avoiding that and just using exercise as a means to feel better and heal is always going to be the first, like that's the gold, right? That's what you want.
Yeah, I absolutely agree. And I think you made a really important point, especially about people that are injured, about having fun, because you can probably speak to this better than I can, but the psychosomatic portion of it is that when you're injured, when you're in pain, like you're probably just in a worse mood. You're having a bad time because you're feeling that input of pain constantly. So even just like having fun in a session where even if you're not doing something to fix the issue, you're doing something, that's maybe parallel to it, that maybe it's not fixing it, but it's not making it worse, and you're moving, you're having a good time, like that's going to put you in a better place than had you not done that. And that might even downregulate pain because you're less stressed out about this injury, and you're kind of getting that sort of trust and that buy-in with yourself that like, oh, like I can be functional, I can still do things without being in pain. So that can be, a huge part to all of this. And that comes with the interpersonal side. It's like, don't be just like another fucking dumbbell in the gym. Like have a personality, like make some jokes, like talk some shit to your clients. Like, it's make them have a good time and like pull them out of whatever they're the mood that they're in, and then put them in the space that you need them to be in to have a productive session, even if that's just having fun. So I think that's a really
Absolutely.
great point.
Absolutely. If you don't like having fun with people, then I don't know why you'd be working with people in person. It's a service industry at its core, right? So it's like you're
Right.
working with people. You can and if I wasn't having fun with it, like again, this is not a job that you get into to make a lot of money. This is not a job that you get into because it's easy or because you don't get to work a lot of hours. It's a lot of hours. There's not a lot of money for a while. I mean, you can definitely do really well with it, but for a while, there's not a lot of money. So if
Yeah.
you don't love it, like what's the point? I love talking to my clients. I love going in. I love hearing their stories. I see them more than I see some of my family members and friends. So it's like you
Yeah.
have fun with them, you have your jokes, and like I said before, it's chicken or the egg when it comes to the brain, the physiology and the psychology, like chicken or the egg. We don't know what comes first, but we know that when you have a good attitude and a good mindset, you feel better.